Hi, welcome to my physiotherapy video site. I'm your host, Brett Wade. The videos contained in this site are for general interest and not meant to replace medical advice or related treatments. Always speak with your family doctor or licensed healthcare practitioner prior to starting any exercise or intervention.
Many people are familiar with the word core as it is applied to usually the center of the body or the trunk. But another way to think about core are these small muscles called intrinsics. Intrinsic muscles, as opposed to extrinsic muscles, control smaller movements of regional areas of the body. These intrinsic muscles, which most people have not even heard of, let alone understand how to contract them or why you would even want to learn how to contract them. We are all familiar with large extrinsic muscles like your quadriceps, for example, which extend your knee, or your upper trapezius muscles, which can do things like elevate your shoulders or your scapulae. But the names and the actions of these smaller stabilizing intrinsic muscles, like the ones in your neck, which we're going to talk about today, they also exist in your back, in your scapulae, in your hip, in your foot, in your hand. And many of these other smaller, more mysterious muscles have these individual actions which produce very slight motions or very slight movements that most people are completely unaware of. For example, did you know that on the bottom of your foot, there are 4 layers of muscles called the foot intrinsics? And of those 4 layers of muscles, you have several which actually abduct or spread your toes. In a future video, I'll discuss the importance of those core muscles, but for now in this video, we're going to examine the effect that learning how to contract these intrinsic muscles of your neck can have in assisting with things like chronic neck pain, which may result from injuries like whiplash. They can also be helpful in learning these exercises to contribute to maintaining an overall effective posture. In a previous video, I showed you some exercises and ways of contracting the muscles of the core of the trunk. And if you've seen that, you'll remember that the purpose of contracting those muscles was to teach a person how to help them with with injuries of the back. Also to help improve performance in whether it be sports or activities of daily living, like carrying bags of groceries up flights of stairs and preventing back pain. The neck obviously has a lot in common with the low back. Both of them, both the neck and the low back, are parts of a very mobile sections of the spine. The thoracic spine, where your ribs come off, is relatively immobile. And both areas are some of the most commonly injured areas in the entire body. Well, of course, we can't prevent all traumatic injuries, such as those from whiplash from a car accident, or prevent things like falls or traumatic sports injuries. By learning how to strengthen these small core intrinsic muscles, we can not only effectively rehabilitate from injuries of these areas, but we might even help to prevent some of these injuries, but also prevent postural strains and excessive forces which might be experienced in sports like contact sports or activities that just simply have higher risks of falls. Incidentally, the highest rate of injuries of the neck in sports are in American football and rugby. Let's jump right in and take a look at the anatomy of the neck. Firstly, before we get into the actual muscles, let's figure out how much mobility there is at the neck. There's a wide range of what is considered to be normal range of the neck. The neck is also known as the cervical spine. And this variability is largely affected by age and history of injuries. In general, most adults will have approximately 80 to 90 degrees of flexion, that's bringing your chin to your chest, 70 degrees of extension all the way back, 20 to 45 degrees of lateral or side bending, and approximately 90 degrees of rotation, turning your head to either side. It's interesting to note that most of your ability to turn your head side to side to rotate is actually occurring only between two vertebrae in your neck, the first and second cervical vertebrae, known as the atlas and the axis, or C1 and C2. You actually have 7 vertebrae in your neck, and other than between the atlas and the axis, which have a relatively high amount of movement, between the other cervical vertebrae, there's actually very little movement. As with any joint in the body, all the joints in the neck as well have ligaments which are going to prevent the joints from moving too far. You're also going to have joint capsules surrounding even these very small joints in the neck, and that lubricates the joint. The other reason that, other than again between the atlas and the axis, C1 and C2, there's relatively very little movement between each of your vertebrae, is that you have a spinal cord which runs from the base of your brain all the way down through your vertebrae. So you don't want a lot of movement there. So the vertebrae has an important job to prevent excessive forces on the spinal cord, also the nerve roots which come out of the spinal cord. In addition, there are of course arteries in the area that also need to be protected. The intrinsic muscles also have a role to play, which we're going to talk about, in helping to stabilize the spine, and they do this much more dynamically than, say, for example, a ligament, which would be passive. The muscles are active, and they can actually help prevent your neck from further damage. Speaking of muscles, let's begin by examining a few of the large extrinsic muscles. These muscles which move the head and neck through a large range of motion, relatively speaking. Starting at the front of the neck, the first muscle which moves the neck through both flexion, lateral flexion, and rotation is called sternocleidomastoid. This extrinsic muscle, which gets its really crazy name from 3 points of contact, 3 bones which it attaches to, the sternum, the clavicle, and then it runs all the way up to just behind your ear, called the mastoid process. With both your left and right sternocleidomastoid contracting together, that's going to flex your head forward. When just the right sternocleidomastoid contracts, it's going to side bend you to the right and rotate you to the left, as if you're deep in thought. Scalenes are another group of extrinsics on either side of your neck. And unlike sternocleidomastoid, they don't do a lot of rotation. These ones primarily just bend you to the side. At the back of your neck are a group of muscles called splenius capitis and splenius cervicus. And these muscles will act to extend your head backwards when working together. These are by no means all of the extrinsic muscles. There are certainly many more, but those 3 main extrinsic muscles again move the head through a large range of motion. Now we're going to look at some of the smaller intrinsic muscles, finally, known as the core of the neck. The first of the core muscles which I want to bring to your attention is longus colli. Longus colli is often known just as itself the core muscle of the neck. It attaches to the front of your 7 cervical vertebrae and then extends upwards, 1 vertebrae or perhaps several at a time. Longus capitis works with longus colli, originating a little bit higher up on the upper few cervical vertebrae, and this attaches to the base of your skull. Collectively, longus colli, along with longus capitis, are known as your deep neck flexors. When they contract, they perform a slight nodding motion, bringing your chin towards your sternum. The other 2 intrinsic muscles that I want to talk about are rectus capitis anterior and rectus capitis lateralis. They are much smaller intrinsics than longus colli and longus capitis, but are also considered part of the deep neck flexors. Rectus capitis anterior runs from your first cervical vertebrae and attaches to the base of your skull. Rectus capitis lateralis runs from the atlas out on the extreme sides of that first vertebrae before also inserting into your skull. These small muscles assist with short neck flexion, but also all of them are key stabilizers of your skull as it attaches to your first vertebrae. So now that we've looked at some of the anatomy of these small core neck muscles, these intrinsics, and understand that they're not only deep, but they stabilize and provide a nodding motion, we need to do a test to see if they are indeed weak. There's no point in giving strengthening exercises for muscles which are strong. For the record, due to the fact that most people sit with a forward head position most of the time, I actually think everyone can benefit from incorporating some of these exercises I'm about to show you just with your general strengthening program. But let's jump right in and do the test for longus colli, longus capitis, rectus capitis anterior, and rectus capitis lateralis, again known as the deep core muscles of the neck. Okay, everyone, I'm about to now show you the test for endurance for your deep neck flexors. Obviously, an endurance test implies that muscles are held for longer periods of time, and the word when you hold a muscle without moving it is called isometric. So I have Honora here, and I'm going to have her demonstrate the isometric test that I would do with my patients for deep neck flexors. Just to let you know that the data has, or the research has shown that the average length of time that a female can hold their neck in this flexed position, which is a chin tuck again, is 29 seconds, and for men is 39 seconds. I'm going to show you the test, but you could of course do this test on your own at home. Once I show you the setup, you can certainly do it all by yourself. I have Honora in crook lying, which means she's lying on her back, her hips and knees are bent, and her feet are flat on the table. At home, obviously, you just do this on a floor, no pillow underneath. What I'm going to do is I'm going to guide Honora's neck just into a little bit of flexion so she's tucked her chin, and I'm also making sure she knows not to activate the extrinsics, that sternocleidomastoid, or the trapezius muscles. We just keep those nice and soft. Perfect. So she's in this flex position. Now, Honora, I'm going to get you to lift your head just enough so I get my hand underneath. Good. And stay in that tucked position and hold there. I'm asking her to maintain this tucked position, and I'm looking for no activation of sternocleidomastoid. And if she touches the back of my hand for more than 1 second, the test is over. She's doing a really good job of holding her neck up here. And again, if she can maintain this for 29 seconds, that's the average length of time to determine an average strength for these neck flexors. You can go ahead and let your head back down. So for home use, again, you don't necessarily need somebody with their hand underneath it. You would just hold that flex position about 1 inch off the table, and just you can feel the side of your neck muscles, sternocleidomastoid, just to make sure it's not overly activated. If you can hold that for 29 or 30 seconds as a female, about 39 seconds for a male, you're about average in terms of your strength for testing endurance of your deep neck flexors. Once you've determined that either you are weak or you do want to strengthen your exercises, that's up next. For this first core neck muscle exercise, you'll notice that I'm in crook lying. This was the same position we used for the test. What I'm going to do again is do my short neck flexion, making sure that sternocleidomastoid isn't yet activated. While I hold that short neck flexion, I'm going to curl my head all the way up. Now holding it here for just a moment, making sure again I'm activated in that short neck flexion, not activated sternocleidomastoid. I'm going to now keep that tuck as I slowly allow my head to come back down. That movement should take about 4 seconds, and you want to repeat that 2 more times. I would consider this to be a level 1 exercise with somebody who was unable to maintain the average length of time in the test. And this exercise can be done twice a day for 3 repetitions, taking 4 seconds, and approximately 1 minute rest between the 3 repetitions. So I'm going to demonstrate that once again. Tucking the chin, making sure I'm not activating sternocleidomastoid, passively bringing myself into full flexion, leaving my hands, and slowly allowing my head to come down. the whole time maintaining that tuck position of the neck. So that's level 1 for core intrinsic muscles. For a more challenging core neck exercise, what we can use is some resistance band. This is probably about a medium level of resistance band, and with different manufacturers it's going to be stronger or lighter, usually dependent upon the color. I'd recommend starting with a very light resistance band. For this exercise, not only will you need a band, but it's helpful to have a mirror, which I have in front of me here. What we're going to be doing in a second is I'm going to have the band, put some tension in it. I've had it around my neck. I'm going to place my hands in front of me at about 90 degrees. And then I'm going to make sure my shoulders are down so they're not up around my ears, activating extrinsics. I want to turn off the extrinsics. So they're depressed. In other words, pressed down and pressing forward a little bit. And then what I'm going to do is I'm going to actually start with my chin poked forward, and then against the resistance of the band, with my hands stretched out, I'm going to pull back with a tucked chin against that resistance. So let me demonstrate that. Again, with this exercise, I'd recommend doing it the same number of sets and reps. So that is 4 seconds, taking your head slowly back from fully protruded position or fully extended position. That's with the chin poked out, as I'll demonstrate. Taking 4 seconds to come all the way back, relax for a minute, and repeat that 2 more times. So let's take a look at this exercise again. Much more challenging. Only do this if you don't currently have any neck pain, but an excellent exercise for strengthening the core intrinsics. So here we go. I've got my hands. I'm putting a little bit of tension on this band, and I'm reaching them out at about 90 degrees, depressing or pressing down my shoulder blades and rounding them forward just slightly. I'm going to start with my head, my chin really poking forward. Now to begin the repetition, I'm tucking. As I pull back against resistance, and then relax. Again, that whole repetition takes about 4 seconds. So let's have a look at that again. Starting in my depressed shoulder blades, protracted slightly. Starting with my chin poked forward, tucking the chin as I come back. And relax. Again, making sure that you don't activate those sternocleidomastoid muscles, which that's the mirror. Obviously, one of the benefits of it is that you can see that you're not overly activating those extrinsic muscles. So again, much more challenging core neck exercise. This one, again, I would recommend 4 seconds of contraction, 3 repetitions with a rest for about a minute in between. If you need more of a challenge, you certainly can get a stronger band or do a few more repetitions, but again, always respecting that you don't want to increase any pain, and you really shouldn't be doing this exercise if you have any significant neck symptoms at all. Okay, so I've shown you 2 exercises for strengthening the deep intrinsic muscles or the deep core muscles of the neck. I'm going to now show you another exercise or another way of activating the core muscles of the neck that can be then applied to all of your standing resistance or strength training exercises that you might be doing. So for this exercise, what I have with me is are a couple of dumbbells. If you don't have any free weights or dumbbells at home, you certainly could use something like cans of soup or a resistance band. But I'm going to show you the general concept for the foundational pose. I believe in previous videos I called it the basic standing pose. And that in previous videos was primarily looking at activating for the core in the trunk. Well, today we're going to build it right from the feet or ground all the way up, and lastly bringing in the neck. And we can do this once you're set into that pose. You then can add any challenging exercise. So let's begin. I'm going to start with a couple of the dumbbells and holding them obviously in left and right hand. Begin with your feet about hip distance apart. Once you're spread hip distance apart, dome up the arches of your feet. So like raise the arches of your feet, activating those arches. Slight bend in the knee, and take your knees and just point them outwards a little bit. With your knees pointed outwards, just make sure you're in between neutral, between a full anterior forward tilt and posterior tilt right in the middle. Once you're in that middle position, belly button comes in, And the last thing you want to do is just add that little chin tuck we've been practicing. Now, once you're here, you can do any challenging exercise for your upper or lower body. I'll demonstrate, for example, what biceps would look like in this position. After completing a full set, you would then, and that set might, by the way, be 10 to 12 reps for you, then you're going to just rest your body and prepare for either another set. I'm going to show you how this could be done for deltoid, for lateral raises. Same thing, feet are hip distance apart, domed up the arches, knees slightly bent to the outside, neutral pelvis, belly button comes in, chin tuck, and lateral raises. And then you would release again between your sets. Another example could be for triceps. Same position, chin tuck at the end, and release. You could, of course, also do this for squats and for lunges. If you want to make this more challenging, obviously you can use heavier weights, but you could also consider something like standing on one foot. If you stand on one foot with your weights, do the same exercise, finally doming the arch of the foot, slight bend in the knee to the outside, belly button comes in, chin tuck, and you can see how you could make that much more challenging. So these are just some ideas in which you could integrate the deep neck flexors with all of your exercises, and you're really only limited by your creativity. I hope you've enjoyed these videos about learning about the deep neck flexors and why you would want to perhaps recruit them and bring them into your strength training programs. Know that these exercises can be useful to help deal with some chronic neck injuries that you might have had in the past. You could also certainly use them in prehab or preventing injuries, perhaps in sports or just through your activities of daily living. If you've enjoyed this video, I would appreciate you giving it a thumbs up and consider subscribing to the channel, in which I have yoga videos, physiotherapy videos, and meditation videos. That's all for now. See you next time.